Good afternoon, and thank you for everyone for coming along on what's a very dark, cold evening. Welcome to the Children's O&S meeting today on 21st of November at BCP Civic Centre. Just ask the Democratic Services Officer to read out the housekeeping notice, please.
Thank you, Chair. Please note that this meeting of the Children's Services Overview and Scrutiny Committee is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chairman. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the surface car park at the front of the annex. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. Thank you.
Thank you, and I'll ask the Democratic Services Officer to confirm any apologies for the meeting.
Apologies for absence have been received from Councillor Brian Chick and Councillor Simon Ball.
Thank you, and do we have any substitute members for this meeting, please?
Yes, Chair. Councillor Michael Tarlin is substituting for Councillor Chick.
Thank you, and any declarations of interest? Councillor Moria.
Just as we're going to be discussing EHCPs, I teach young people with EHCPs, and I have had a child with an EHCP.
Thank you. Just to confirm that I have a family member who's in receipt of an EHCP BCP Council. So, confirmation of minutes. Has everyone had a chance to look at the minutes, and are there any comments on that? Councillor Harman.
Hi, just a minor thing. My name has been spelt incorrectly under section 20 when it's talking about declarations of interest. Thank you.
Thank you. We'll make that change. Any others? If not, everyone happy to agree them and get them signed subject to that change? Yep. So again, with the action sheets, everyone happy with the action sheet and no changes or amendments, comments at this moment? Okay. So agenda item number 5, public issues. Are there any questions or statements from the public at this moment?
A question has been received from Councillor Carr-Brown, who I believe is going to come up and read it out.
Thank you. I think there's come up here, be easier. Thank you.
Thank you, Chair. My question is, what provision is made for young people in receipt of an EHCP as they transition from CAMS to adult mental health services? We know that up to 80% of autistic adults have a mental health condition, and we also know that EHCPs extend to the age of 25, but CAMS services end at 18. Transitions are difficult for autistic people. So what special provision or pathway is in place or could be considered to ensure that this very vulnerable group of our residents doesn't lose access to the services they need just because they've turned 18?
Thank you very much, Councillor Carr-Brown, for your question. And Councillor Burton, I invite you to respond.
Yes, thank you, Chair. Thank you, Councillor Carr-Brown, for the question. The mental health of young people is a concern to me, and I know also members of this committee. And I know that transitions between one service and another is always a stress point. The provisions will be considered as part of the annual review of an Educational Health and Care Plan, EHCP, which will ensure that EHCPs from year 9 onwards refer to preparing for adulthood. When children and young people are in year 10, the adult social care preparing for adult team will attend the CYP's annual review and consider whether they may need care and support from the adult health or care services when they're 18 and over. This would include those young people who are open to child and adolescent mental health services, CAMS, and who may need support from adult mental health services, AMS, if the young person are going to move into adult services. Both CAMS and AMS will work together to plan this transition with the young person.
Thank you. I think, judging by Councillor Carr-Brown, there might be a follow-up question at another meeting to that. So thank you very much. So item number 6 is the Members of Youth Parliament verbal update, and I know you've had an incredible week. And I have to say, tweet of the year has to go to Dylan's mum, who was clearly so excited about the adventures and experiences you've had this week. So I'm going to pass on to our Members of Youth Parliament.
Absolutely love that, Chair. Absolutely love it.
Terribly sorry. Hi, for those of you that don't know me, I'm Zara Sosick, and Dylan will introduce himself later, though I accidentally just did that then. And I'm just going to go through my campaigns and any updates we have on them. So starting with my anti-bullying campaign, those of you who were here beforehand know that we had a little bit of a slow start, but it's picked up recently. So we started by creating a survey and sending it to the Anti-Bullying Alliance. The Anti-Bullying Alliance consists of teachers from across BCP with any kind of anti-bullying role. The feedback was based around the main causes of bullying, the treatments, and what's worked and what, quite frankly, hasn't. So with this, we found the 3 leading causes for bullying within schools were cyberbullying, both on social media and text messages, family conflict, and friendship groups. With all of this, we ran a workshop with young people with a range of backgrounds and ages during Anti-Bullying Week, so very topical. And with all of the research we've now gotten back, I will create a summary, and hopefully in spring I will then go back to the Anti-Bullying Alliance and present everything. Now onto my neurodiversity campaign, and those of you who were here beforehand knew that it took a while to take off and it took a lot of work, but in the past few months it has again picked up dramatically. So I've met with the educational psychologist over 3 times, and I have another meeting scheduled for the 6th. So Becky has kindly put on the was it a board? On the board with what was the original unchecked information, mind you, from AUB. So this is kind of what it will look like. The information has now since been updated a lot, but as you can tell, it's very plain, so it can be very legible. They even worked on making it so those who are colorblind can see it better, so we love that. And you can see that we have little diagrams. So Becky's now going to show you the kind of a mind map I did with all of this, with the now updated information. Okay, it is very busy and not very legible. It is a mind map. I'm unfortunately not a commissioned artist, which you couldn't tell. Thank you so much. I'm unpaid, mind you, free to donations. I worked on especially doing interactive diagrams so we could have some kind of visual understanding going on. It even has prompts in things like speech bubbles. So the main feedback from the oh, sorry. So the oh my god. So this is my kind of updated mind map version. So as you guys can tell, it's a
get there. So
oh, so okay. I forgot that was mentioned in the last one, but I have to. So an update on that, because a lot of you have recently been elected in, which is so fun.
get to the changes. Who did you meet with?
Yeah, so we met with Peter from the educational psychologist. Thank you, Becky. And after deliberating a lot, we found that prompts worked a lot better. So for those of you that don't know, this was essentially built off the idea that schools are very adverse to the idea of disorders, and this actually led to me coming up with the idea that individual symptoms should be treated rather than finding an umbrella term that maybe someone doesn't qualify for but still struggles with the same kind of problems. And now, as you guys can see, we have a prompt of maybe how someone is feeling and then what to do with those feelings. Again, handwriting, not all there, but bear with. And then hopefully we're going to send all of this back to AUB before Christmas. They can come up with their beautiful design with all of our feedback. And then this could hopefully be given out throughout all of BCP's public spaces where young people will frequent. So primarily schools, but hopefully doctors' offices and libraries, as a kind of resource for people to use regardless of diagnosis, social background or circumstance. So it's a very universal thing. There will be links on the QR code, so there'll be links to websites, me talking, hopefully less waffly than this, and yeah, so it should be a brilliant resource that once diagnosed, I will be very proud of. And thank you for listening to me, and I'm going to pass over to Dylan.
Hi, I'm Dylan. Is my mic is working, isn't it? Yeah, okay. My name's Dylan Riskashan, for those who don't know. And I'll start off by kicking off the debate with young people. It's a debate that we ran for 11 to 18-year-olds, which some of you came along to. Lovely Mike that's stepping in today came along, and David Martin, and Emily and Marina. Oh, I can't see them. Oh yeah, and Peter. Yeah. Quite a few. But yeah, no, I thought go there. So it's yeah, it was low. So I mean, I'll kind of come on to the amazing turnout of elected members. But it was a really brilliant learning experience for me. And it was, as I've said, fantastic councillor and young person turnout. Probably around 10 more than I thought I would expect, which kind of threw me off a little bit. But thank you guys for coming. And it made it such a great experience that so many people my age got to interact with councillors and have a chance to be picked by Councillor Burton to speak in the Town Hall chamber. The debate topic was around universal free school meals, which was developed to help me and Zara prepare for the upcoming House of Commons sitting, which I will talk about more in a second. And despite a slight hiccup with the unbalancing of groups due to walk-ins, I'll admit that was my fault. It really made my evening when one of the 11 to 18-year-olds attending put on the biggest beaming smile after speaking. It really made my night. So then on to House of Commons sitting, and then with the newfound views of young people in BCP at the debate, my research around my debate topic, the quality of food, had the opportunity to be one of 12 NYPs from across the country to speak over the dispatch box at the annual House of Commons sitting. And the fabulous Zara also had the opportunity right after my speech to be called on by the speaker and deliver a brilliant speech. I've had some lovely responses on Twitter from my debate, including Councillor Vicky Slade, the wonderful Councillor David Martin in the room tonight. Rather surprisingly, a soundbite from the start of my speech being played on Radio 4's Today in Parliament, which Councillor Kieran Wilson enlightened me about after hearing it live. It's been a bit of a whirlwind of a weekend, and speaking where all of my political heroes and villains have spoken before me in the most prestigious and historic chamber in the world was once in a lifetime experience, which I will never forget. And I'm so thankful for my dad to getting me, Zara, and Becky to Basingstoke Station after our train literally completely shut down at Hinton Admiral. I mean, the computer switched off completely. Thought my car was going to take off. And Becky for being brilliant at continuously supporting me, and everyone who's left lovely messages after the surrealist and probably one of the best days I've ever had. If anyone would like to watch my speech, my handle on Twitter is @Sean Rees, which I think Becky's going to put in the chat. Yeah. So, and you guys can give me a follow if you like as well. I don't know how fast having people are, but yeah. And then finally, we've got an amazing opportunity next Tuesday on the 28th of November, an elected member engagement session similar to the one we ran last year, where me, Yaz, Gray and Ava will be showing a presentation and delivering a session to hopefully help all of you guys interact more with 11 to 18-year-olds through surgeries and further ways to engage with young people. So email me, Becky, whoever to sign up, and because I'm pretty sure the form's still open, isn't it? Still haven't sure. Yeah. Brilliant. So they've got, apparently everyone's got an invite. So I'd like to see as many people there. It would be amazing. But yeah, any questions for either of us?
Councillor Hartman.
Yeah, not a question. Just I wanted to reiterate what a pleasure it was last week to be part of the debate with the 11 to 16, 18-year-olds. How they were just the most articulate young people, and the confidence you could see. I think a lot of them, when we were having the discussions, were a little bit nervous, a little bit apprehensive, but when they stood up with your guys' support and the encouragement in the room, it was just an absolute joy to see that. So thank you so much to both of you for putting that on, hosting the whole event. It was seamlessly run as well, really confidently, and I think it added so much value to those young people. So thank you for allowing us to be part of it.
Thanks for saying that's really lovely of you.
Councillor Tarling.
Yeah, the comment I did put on your Instagram post, and I noticed you're on the opposition benches. I hope one day to see you on the other side of the dispatch boxes.
Oh, thanks. No, am I not allowed to comment on that? Oh, sorry. Must be non-partisan, sorry.
And Councillor Cooper.
Yeah, I second everything they said. A question about where do you think we need to go with school? When you said the comment that schools don't like to acknowledge the kind of vast range of diversity and what a complex problem that is for them, for individual teachers, but also for the institution to embrace it and improve standards, really. Where do you think your work could have the most, the greatest impact, and what would be the next steps, for you, really, in that one? Thank you.
Thank you so much. It's the question I always literally love to hear for this kind of project. So my project's basically designed to, are all of you familiar with cognitive behavioral therapy? Before I dive in, I'm going to call it CBT. Just so a lot of my work centered around self CBT. So as we all know, normally CBT is administered by another person. And I found with a lot of the young people who have come to me about mental health services, the issue was that one, they didn't want to talk to someone about it, especially if they didn't know them. Two, it cost money if you wanted to go into the private sector. Or three, you needed a diagnosis to get treatment, which unfortunately, I'm sure most of you know that so few people get diagnosed. And if you go into the private sector, it can cost around £750 even to get evaluated, which if we're looking at lower income families where sometimes you have higher rates for disorders, it's just not going to work, and then these children are being systematically denied the help they need. So what my project is designed to do is to help people understand one, themselves, identify how they're feeling, and then from there know possible treatments that can help that don't require things like any kind of higher monetary backgrounds or even any kind of higher education type of pursuit, because a lot of people think that they need to be very, very fluent in how psychology works to even begin to break down how they're feeling, which is so unfortunate. So a lot of our surveying went into young people, just asking them, so what do they do if they're upset? And a lot of the treatments that they use themselves just weren't healthy, like whether it was relying on substances, unhealthy habits, all the way down to things like criminal activity to cope with things like their background. So this is designed for all ages, even adults, even if it does look a tad bit juvenile. So the aim is, if I'm feeling something in a classroom, for example, most of the things on there, there's at least one or two suggestions that don't require leaving the classroom, so it's accessible for schools without them saying, well, our young people are just going to use this as an excuse to get out, which of course isn't what we want, but we've provided plenty of reasons that they could adequately address these feelings without having to leave the classroom. And if they were to see it frequently enough in a public space, they would then know how to address these feelings on their own without needing a visual aid. There will also be leaflets, which I don't think I actually mentioned. So it comes in poster form, and then all of the posters will be compiled into a leaflet, which a young person can take. So if they just need a little pick me up, they can see it. So what would really help us is if, one, it would be wonderful if something like this could be integrated into PSHE. So if there was some kind of something taught in school for people to how to regulate themselves, especially when transitioning into things like secondary school or even things like adulthood. It's really unfortunate as people with without diagnoses, it often gets worse, which I'm sure most of you are aware of. And I think there's even an agenda item here which will address that, as there was a question about it. So if people learn how to do this from a young age, they could then go on and they could develop these things. And just the skills of being able to break down how you're feeling can then go on to develop into, okay, well, this is a really big thing that's just happened to me. What are steps I can take now to avoid me from spiraling? So if we wanted this to make as big of an impact as possible, which is obviously always my aim, getting it into as many schools as possible, doing maybe like an assembly or something to show students on how to actually use the poster and the leaflet, and then maybe just some sessions on how to unpack how you're feeling would be really helpful. And thank you so much for asking, by the way. Thank you.
Thank you so much for that. And Zara, I really hope that you'll be contributing quite positively in our next item. I am going to just move on though, because I'm just aware of the quite heavy agenda tonight. But let me reiterate our thanks again to our members of parliament. Thank you very much. So agenda item number 7, young people mental health services. So we've got Elaine Hurl here, who's the head of children and young people's learning disabilities and adolescent mental health. Helen Duncan Jordan, is that correct? And I think online we also have David Freeman to present the item. Thank you.
Thank you, Chair. Hopefully that's okay. Many thanks for the invite to come back to Scrutiny Committee. I think it's a little while since I came, and since I came last, we've done quite a lot of work around getting a project going, and this is really to bring this to your attention for support partially, but also to give you an update on where we're at and then our next steps, which hopefully your support will enable us to sort of push forward with. So I'm going to talk mostly, but Helen will interrupt when I either go off on one. I might get a kick under the table, or if I've missed something that's really crucial. So I hope that's okay with everyone. Chair, hope that's okay. Thank you very much. So we called Your Mind, Your Say, the project. It was designed by young people actually in 2020. Prior to that, the NHS and local authorities had a plan to transform mental health services for children, young people. We were starting from a really poor place, to be fair. Young people's mental health services were funded nowhere near as well as adult mental health services, and that isn't brilliant, to be fair. So we were starting on the back foot. But in 2020, we'd all sort of had enough of the same conversations about how difficult it was for young people to access our services and to get a really good experience. So in 2020, we did all this view seeking, and we worked with Becky and lots of other people. We went to youth parliaments. We did about 56 different types of event where we looked at mental health services, and we created a project and view seeking reports done by Bournemouth University. And I'm just going to move on to this next slide, because what we heard in 2020 was echoed after COVID in last September. And I'm just going to say on the right hand side there are some comments from families, and these are comments that I've highlighted as they're really negative, but it's balanced in the view seeking report by a lot of positivity as well, in the sense that once a young person is seen by a practitioner, there's usually a really good experience, and the practitioners work really hard to make sure that the young person's heard and understood and gets the right sort of treatment. But some of the views of families who very generously gave their sort of thoughts about how children's mental health services were experienced, I've just described there. So people already think it's going to be difficult getting in to see mental health workers. There was one mum who told me that she had to coordinate about 8 different professionals in order to get the support that she was angling at, and really it should be the other way around, shouldn't it? And the one that really kind of got me was that a mum who's when her daughter's having a sort of meltdown, they drive around Dorset and they pitch up then at McDonald's in the early morning because it's the one place that's open and accessible once the young person's kind of calmed down because of the driving. So we've got lots of scenarios like that, and we did hear those views in 2020. We also heard them in 2023. In 2020, we would have moved into this project in March, but you know what happened in 2020 in March? All hell broke loose. We were all locked down and COVID, and we're still feeling the effects across the system from that. So we finally got cracking in March this year. Currently, access to NHS mental health services for young people are set in tiers. You know, and you start in that sort of tier 1, tier 2, tier 3, tier 4. Tier 4 is the highest level of need, so inpatients. And in the transformation plan, we want to move to Thrive, and we're already talking about the language of Thrive. And Thrive is sort of it's a model of access that describes a young person's needs changing at various times, and that young person being able to access the right type of help at various times. So that's where we want to be heading. In Thrive, there's a notion of thriving, and you might say that around 80% of young people thrive. They might have bumps in the road because of life circumstances. They might need support during those times. They might access school support. They might access lots of different things, but in the main, can really get on with their lives and thrive. The rest, however, we would want to look at providing additional support for. So in the Thrive model, we have getting advice, and this is all sort of early help things. So in schools, in primary care, those kind of things. Anywhere where young people pitch up, we should be able to provide some level of support and information about what good mental health looks like. and that most young people will probably benefit from that and manage to kind of come up with coping skills and abilities. We also have getting help, and this is kind of the next level up where the advice is given, but they might still need a bit more active intervention, one-to-one. So, for example, in our mental health support teams in schools, we offer assemblies and really good advice about what happens around mental health. But a young person who doesn't find assembly that helpful can have one-to-one contact with a mental health worker. So there's those kind of things that are already happening. And of course, the council and health funds those kind of early help interventions. Feel free to, if you need to. Oh, okay, just saying. Excuse me, just a reminder. Getting more help, but again, it's a sort of it's ability for services to respond to a young person's needs. As and when those needs arise, and we haven't been very good at it historically, partly because of the tier system, partly because the NHS nationally only funds local services to see around 30–40% of young people who we might expect to have a mental health condition. So, like I said, we're starting a bit on the back foot around this. And then, of course, in the next quadrant, we've got risk support, which takes the support up a notch for young people who are really unwell, who need proper treatment support, maybe inpatient access, maybe not, but actually rounded support around them and their families. So this is where we're sort of heading. And it's not an easy ask because it is fundamentally going to shift the way services have to behave in the direction of young people. So in 2020, these were the kind of themes that were coming through from the view seeking. It was very much focused on trauma, around seeing young people doing no harm. CAM's expertise, NHS expertise shared much sooner in a young person's kind of developmental mental health condition, those kind of things. I'm not going to read them all out, and these slides will be sent out or have been sent out already, so hopefully you'll have seen them. When we started in March to do proper project around this, we first met as a project group, and in the project group it's a real good mix of NHS staff, local authority staff, young people, families, parent care organisations. We decided that we wouldn't be condition or diagnosis led, and that we would include all those things because this is likely the type of conditions that young people are will present with. But we decided that the support offered wouldn't necessarily be focused on their condition, but more on their need in that moment. We set up a proper project. If you like governance, you'll like this slide. If you're less fond of it, like me, you might think differently. But we set up a project just so that we can really report on our work and progress going forward. We set up a project with a project rhythm. At the top there, you'll see project group, modelling sessions, and then check and challenge. We pretty much ran project group on one day, modelling sessions with Dorset Council and BCP council colleagues, 2 separate sessions. And then we ran a check and challenge session, which we did through Zoom. This was only for young people and their families to access. And basically we were sort of kind of cross-checking all the work with each of the group as it evolved. And we did that 5 times, I think, maybe 4 times. 4 times. And we've just sort of completed the last of those sessions that were set up. I think September was the last one. There were some assumptions in our project. There's already a lot of money that the NHS funds, not enough, but there is a lot of money in the mix. So we'd agreed that the money that we invest already would stay, would keep. Hopefully there will be the notion that we'll request additional funding as needed through the project. We acknowledged the gap between 40% of young people and 100% of young people. The NHS long-term plan says that we're going to support 100% of young people who've got a mental health need. We're nowhere near that at the minute, and unless the NHS is funded appropriately, that's not going to happen either. That partnerships across the local system was a really, really key feature in the project, and hopefully the feedback, if you've had any from people who've attended, you'll see that it was very much designed so that anyone interested could have their say and contribute.
Well, and also just on that, looking at opportunities to join things up. I think the premise of the transformation was also about integration. Where can we bring services together? How can we bring access points together to ensure that we're most effective and efficient as a system?
Yeah. Thank you. And some of these were the I don't know. We brought about 180 people together in those sessions, and the first contact was what would be your sort of red line, what would you absolutely want to see in the project? So we got 180 of those comments. We refined them to these 13, and then we refined them a little bit further down, so we've got 5. And we very much focused on children and their families really being at the centre of everything, and that families were to be much more in control of how we responded to them as a unit that usually comes with a lot of knowledge and skill around their own particular needs, that we would aim to help much more quickly when needed, and that we would try and work as far as possible in a sort of no wrong door approach, so that we wouldn't have thresholds or barriers wherever possible, and that we would try and look at how we use our investment so that it was used in the best possible way. And as Helen said, that might be about joining things up a little bit. I don't know if you know about the straw man sort of method, but this is the one we took. You have an idea, you thrash it about, you argue, you usually comes some kind of consensus, you refine it, you agree it, and you have that cycle, which is pretty much what we did throughout the project. These were some of the things. I'm going to skip through this one quickly because it's quite hard to read, but we've refined each of the kind of ideas that we've had and then come to this, but these are the very much fundamentals that we sort of landed on, that we want NHS, local authority and voluntary sector organisations to work together, to integrate where possible, to co-locate where possible, to share funds where possible, and have joint ownership over those kind of things. So these were some of the bits of our services that we wanted to really work on. We talked about sort of, I don't know, young people, you might have been to a theme park lately, or Legoland or Thorpe Park, or maybe you haven't. It's not my bag, but you know, if you have, you'll know that you'll usually go in, there'll be a load of ticket stalls, so you can all crowd in, you can get to your sort of central location where you'll get signposts and information leaflets about what's on, what time the shows are on, and all that kind of thing. This was designed by the modelling groups. We thought the kind of approach of a theme park and the sort of crowd management and all those things were kind of useful to look at that in terms of how children's mental health services might look. It's about managing expectations. It was about having really good guidance and support initially at that very first contact through the gate. It was about making sure that if you needed something very specialist, you had access to it. There might be a little bit of a wait, but you had all that information up front. You had someone potentially guiding you through the system, like a navigator or a support worker. Or we haven't landed on the name, but at this stage, it was about all that kind of thing, that as soon as you come through the door, you're welcomed, you're asked what's going on for you and your family, and then you're supported to get to the right place in the park.
And most importantly, there's a gift shop at the end, because everybody loves a gift shop, so that people, when they're leaving services, make sure that they've got something to support them.
Yeah, exactly. And also that you can come back if you want to, so that it's not door closed. So you can leave and never come back, or you can come back as and when you need without referral, without having to go back to your GP necessarily, those kind of things. So in the overall sense of this project, we've got the notion of early help. So that's in schools, in primary care, in other settings that young people tend to be. Interestingly, young people didn't want it in Pizza Hut, mental health support and advice, but they did want it in youth centres and other places. So these are all parts of our plan. Crisis Cafe kind of services have come up in our discussions in 2020 and more recently, so we'll probably pursue those. We are thinking about multi-agency offer, and hubs are kind of frequently talked about at the minute, and we're going to have hubs coming out of our ears at this point, but at the same time they're probably the best place that we can bring services and members of staff together. We'll likely have to reshape the current CAMS services because they won't necessarily, as they currently are, fit with the new model. But again, these are kind of discussions that we've yet to have. And we are really, really wanting to align the development of this offer with the family hubs and other bits of neighbourhood work. So I'm just going to skip through these, only to say that there's a lot of transformation work happening across Dorset in both councils and NHS land. And they're all really rather saying the same things, that people want quick, easy access. They want it near home. They don't want to have to repeat the story, all those things. And without exception, in health world, people are saying those kind of things. So all the models that we're developing, sorry, that was the CAMS children's mental health one. This is the adult mental health one, and this one's already being implemented at various stages. And then in primary care, also we've got the same sort of community neighbourhood approach. And in the all-age neurodiverse world, this is the proposed new model that's come through the co-production piece of work. So hopefully that fits with some of the things that we've already discussed. But I'm happy to take questions in a bit about that. So I'm whistling through and hope that's okay, Chair. Do you want me to wind it down yet? Just checking because I'm... Okay.
You've already got a few slides left. So
yes,
thank you.
Thank you. So just to say that this is a complex piece of work because there are lots of other pieces of work happening that will either complement or challenge. And so I just wanted to flag those up in this area because you need to know that we've got an ambition and we've got a lot of interdependencies as well. So I wanted to just flag those to you. We've started to have conversations about whether the conceptual model of that theme park is doable in reality, because what we don't want is to set expectations and then not be able to come up with it. And our initial conversations are looking really hopeful. We started with Dorset Council just because of timing, and some of the things that Dorset Council are doing along with BCP Council probably really gel with this piece of work. And so I suppose it's how we can join all the dots and ensure that we don't miss opportunities to really knuckle down and work much more swiftly together. So I'm going to whisk past these, but I'm happy to take questions later. So I'm just going to cut to the numbers. So in BCP, and I've highlighted BCPs across Dorset, we've got about nearly 204,000 young people aged 0 to 25. And in the BCP area, we've got 121,000 roughly. It's around 60% of the whole Dorset population that you have in BCP. And in our modelling with Thrive, if you remember, I said that around 80% of young people are probably in that Thrive area. They might need bits of help at times, but generally speaking, doing not too bad. So that means 20% of the young people may need something else in any of those other quadrants. So it could be advice, it could be real good risk support and treatment in NHS land. So across BCP, it's about 24,000 there who would probably need some form of support for us, and that's modelled against 20%. And interestingly, we modelled that, but I've heard NHS England this morning have announced that roughly 1 in 5 young people are probably expected to have a mental health condition. So we probably got it about right across, you know, it matches up with the national picture. So again, in BCP, on the left there, you can see all the primary care networks in the BCP area. And I've put the total population of young people 0 to 25 in there, so you can see roughly the numbers of young people that we've got. And then to the right of it, where it says mental health needs, that's the number of young people in each of the primary care networks who we might expect to have some form of mental health need. And then just for your info, I've whittled it down a bit further. QOF is a register that GPs keep around certain conditions. So if you've got diabetes, you might be on one of those registers. If you're an adult with a serious mental illness, you might also be on one of those registers. And it's the same for young people. So we've got a serious mental illness register and a depression register. So, and that's the number of young people who might expect to see with a serious mental illness in the BCP area. So these numbers will help us shape the various bits of service. But again, they'll need a little bit more refinement, and they only tell one bit of the story usually, as always with data. So these are our stages, and I've deliberately not put time frames on, except to say that we will have a business case drafted, hopefully signed off by the end of March next year. And the reason it's that length of time is that we've got a model, we've got an idea, we think we can do it. We've got to work up the sort of workforce model in terms of numbers of staff, types of staff, what expertise, skill they might bring. And we want to do that in the same sort of co-productive way that we've done the rest of the project. And that obviously factors in a wee bit more time, generally speaking. And I've just put there in that stage 4 at the bottom box, across the system, we've got young people who really come with a whole range of complex needs that our services, being what they are, aren't that good at supporting. And I think we're both fed up, aren't we, of having the same conversations and not being able to really respond to that appropriately. We end up with young people in hospital who shouldn't be, because we haven't got other options. And so we think as a system we should actually bid for this notion around something else that could work for a really complex range of needs. So we've put it in there because that is likely to be costly to an integrated care system that's already a bit strapped. So, but we're putting it in there because we need to flag up that there is that gap. So I'm going to stop rambling on there. Thank you very much for your attention and generosity in listening, and happy to take questions, Chair.
Thank you very much. It's clearly a lot of work that's gone into this. It's completely transformative, isn't it? It's a complete new way of working. And clearly, I think you can hear the voices of people coming through, and this service reflecting the needs. Has anyone got any questions at this point? Dylan?
I mean, first of all, thank you. There's a crazy amount of work that's probably gone into that. But I was just going to pick up about the crisis campus. It's a great idea. But I think my question was about what kind of workforce would you put into those crisis cafes? How many people would be there? What kind of training would they have to be put into that environment? That kind of thing.
So what do you want to? Go on. I'll give the hard ones to help.
So I think it's a really good question, and I think I think in all honesty, we're still working that out. I think there needs to be a real mix of people who can engage well with young people, but also because we're obviously dealing with that more acute end, that that we have people that are very good at assessing risk and managing risk. So it's the conversations that we're having at the moment is a mix between clinical and non-clinical staff. And just in terms of the place, making sure that we get the right place. Thinking about, I mean, I really don't like the term crisis cafe. I think it's not a good one, but it is a nationally, it's what's out there. So we're really still kind of working that stuff through. Any ideas would be gratefully received.
Sure. I think my other one would be, I know you said as an aim of 2. I know you're not kind of working on that, but in terms of population density and, you know, where are you guys thinking for those initial 2 cafes?
So initially we're thinking Poole, and one in Dorset, probably Weymouth. And if you look at the sort of population need in terms of deprivation areas and higher levels of ASC and other mental health conditions, they're probably the starting point. I can't see that 2 is going to be enough in the long run. And I think what we would probably want to do is test and learn, partially because we've done it in the adult world, but young people, the offer's really different. And Helen and I are having constant conversations about whether this is preventative or do we need to tackle the really high end, sort of riskier young people? And it's probably both, but how you combine that into one space is going to be really difficult.
Absolutely.
So we might need 2 different types of space. I don't know. So we're still grappling with that.
Yeah.
Thank you, Councillor Cooper.
Yeah, I mean, you know, where do you start really? I mean, it's a brilliant comment about, you know, the places to go for young people. I won't bang the drum that, you know, we used to have them in every community, and they were called youth centres. And they had 3 generations of people working with young people. So your new starting youth workers, you had the experienced middle range youth workers, volunteers who were generally parents and granddads, dealing with all the issues that you're talking about. And I suppose I admire what you do, amazingly so. But you know, the restrictions you're under in terms of funding and the fact your service has been neglected for 13 years. And then there's a whole storm coming around the corner with, you know, reductions to services. And, you know, one of the things that I've kind of observed.
Question.
Yes, there is.
Thank
I'm
you.
putting it in a context.
Yeah, but political
Thank
context.
you.
If
No,
we can
it's
stick
not.
to the
It's about funding.
agenda at heart. Thank you.
About funding. So the model is really, isn't it, that, you know, once young people come to you, they've hit a point of crisis. So it's the pathways and the relationships between them coming to you. So in terms of all this kind of work that you're developing, and rightly so, and under the restrictions that you're under, what's the kind of relationship between all those third sector, voluntary sector services that young people kind of come and bounce around in? What's that map look like, and how might that help you in stopping more young people having to go into a crisis cafe, or maybe just go and meet their friends, you know, and have a chat?
So as part of the project, we've agreed that the voluntary sector should be funded as a partner, because historically they've had to come you know, every year to us for their grant funding, and that is an inappropriate way to work with partners because they can't plan and can't progress things. So as part of this project, we've agreed that they should be a funded partner. We haven't yet agreed whether we want some sort of framework agreement or an alliance of providers, but we're working through that as part of the next stage. But a really crucial part, because often but we wouldn't need young people to come even anywhere near an NHS mental health service if those things were effective and they're available. So we think that they should be funded properly.
And we are in conversations with local authority youth services.
Yeah. Thank you. And we'll obviously talk about this later when we look at a board plan, but one of the things that we've got coming on is the early help system, the preventative work with youth provision, youth offerings, family helps, community and voluntary sector. So I'll make sure is that we obviously hook in with yourselves and make sure there's 2 pieces of work tie in so we can give a more full and comprehensive overview about what's happening. But Councillor Tarling next.
Yeah, thank you. Very, very insightful presentation. As a parent of a child whose exams were affected by the COVID crisis, and a massive bump in the, to boil it down to statistics sounds quite insensitive, but we've got a bump at the moment of mental health issues related to COVID and young people that have been affected through that. To what extent, and it covers the whole range of education that's struggling at the moment, from reading and writing, but mental health is one that's affected a generation now. Is at what point are we looking at going from dealing with this hump, statistical hump from COVID to a sort of steady state? I mean, is there anything special that we need to be doing to, possibly too late, but to deal with that residual hump of the COVID impact? Thank you.
I think we'll see it for some time. I think, evidence shows that most children are about 2 years, that 2 years behind. So, in terms of kind of catching up, we've got some time yet for those young people to go through the system. So it will take us, we will see it, playing out for some time. And that's the reality of it.
Doesn't feel easy saying that.
No.
That's the reality.
Oh God, I put to my mic on. Hi, sorry. I wanted to ask you about your neurodiversity website. Sorry, it's kind of like two questions. So one, will this be based on referrals from like say a GP with a diagnostic referral, or will this be an open kind of platform that anyone who needs support can go to?
It's going to be the latter. So I think it might be helpful to have a presentation about the emerging model actually, to Health Overview Scrutiny. Be happy to set that up. But in terms of the new model, it's very much focused on anyone looking, getting really good advice for what you're looking on the website. It might be that you don't need to look for a diagnosis or route to that. It might be other things that will enable you to have all the information coming through, and then for you to be able to choose where you go next. And that can be with support or without, so self navigating or otherwise.
And if I'm allowed to just super duper quickly add on, will this be something like they have to look on the website and see, okay, I think I identify with this disorder more than another disorder, and then they get kind of solutions to that disorder? Or will it be, I'm feeling a certain way, and then they can tailor the solution on the website to how they're feeling at that moment?
So I think it's a fair combination of those things actually, because like even that question sort of reflects really different needs of a young person and their family to have particular routes. And I think the way that initial website is designed is to help you, based on your needs, navigate the system. And that might lead you to a diagnostic service. It might not. It might lead you to other sort of support mechanisms. So it's a work in progress, but I believe it's being worked on currently. And it might be just helpful to have a proper update, which we can do.
Yeah, no, that'd be really helpful. Is there anything that can go out to the committee in the meanwhile by way of email? Or
I'm pretty sure, yes, that we can sort that out. And I've had sight of slides today, so we could do that.
Yeah, that'd be perfect.
Sure.
Thank you so much.
Yeah.
Thank you, Chair. Just a couple of quick statistical questions. First of all, it looks like you're doing a huge amount of work, and I know it must be really, really complicated. You've helpfully provided some statistics.
Some.
No, you said that actually the hope is that you'll have 100% funding within schools. Do you have a timeline? Because I know it's at the minute it's 40%, isn't that right?
So the two timelines are slightly different. The NHS access target is we're about 41% at the minute. So it's a term that's a bit weird, and none of us really agree with it. It says that 100% of young people who would have a diagnosable mental health condition would have access to support. Given that most systems are trying to get away from the diagnostically driven thing, we don't agree with it, but probably we're on target to meet that by the Q4. We should have our access target met, but it'll still only be 40%. And the NHS long-term plan, we're waiting on the next iteration that will enable us to see what our next range of targets are. On the schools front, however, I think in Dorset we've got 4 teams. We've got another team coming online. We're about 50% coverage in terms of the schools, and there are 300 of different schools across Dorset. The new bid, we're working on ensuring that BCP have additional EMHPs because you've got higher levels of demand. And we've also been able to slightly adapt the way those teams work. So look at different types of need, because not every young person really is ready for CBT, which is the MHST sort of treatment offer really for the one-to-ones. There are other things mixed about, sure. Do you want to add them?
No, so in terms of the schools teams, if you wanted, you can. There's a list of the schools that have access to the mental health support teams in schools on our website. So you, and as Elaine says, we're not in all, but we're looking to see how we can maximise and get as much information out to schools, because we absolutely recognise from the conversation that we were having earlier on that you know, lots of children have needs. The diagnosis bit is the bit that is the challenge for us. And as Elaine said, we're trying to move away from diagnosis. However, in terms of specialist NHS services, it's often diagnosis that gets you into access to those. Yeah, so it's a work in progress.
Thank you very much.
Sorry, I've just been reminded, if we're not speaking, can we switch mics off, because I think it could affect the recordings. Is that okay? That's my teacher bit over. But I think Sarah, you've got a question again.
Final one, I promise. So you've referred to a lot of the resources that young people who have been diagnosed with any kind of disorder has access to. And I was just wondering, could you give us a couple of examples that any child could access regardless of any socioeconomic background or schooling?
So on the website, you'll see that there are a number of resources. So a little bit like, in fact, actually, I'd be very keen to have your resource on you know, for our teams too, with very similar things. I mean, there are lots of resources out there. I think that the big thing that families say to us is around, you know, what is something that is trusted. So we're working, and we've been working, there's been a piece of work done with Dorset Youth Association around bringing together a website, and on that website are lots of resources and trusted resources that have all been checked and signed up to. So that's where we would absolutely direct people to, in terms of a trusted resource that anybody can access.
I just want to add one. This is not a question. I mean, it kind of is actually, so I'm kind of cheating. Sorry. So in terms of these websites, these are all things that someone would have to go online for, which is obviously great because most young people do have access to the internet. How would they know to, one, look for these things, and two, how to find them? Like, do schools advertise these? Because I know if I'd just been diagnosed hypothetically, and I don't know where to go from there, the first thing I probably wouldn't be thinking was, oh, got to pop on Google and type in and then scroll through a couple pages, because that's what, when I was researching my thing, I had to go to like the third page to find some decent websites, other than the NHS website, which was quite helpful. But I'm just wondering, how would a young person know to actually pursue these resources?
Yeah, it's a good challenge. I think there's something around how professionals cascade that kind of information, and schools kind of using their resources and social media to kind of advertise it. I know our systems or own services all use social media to access and signpost young people, but it's a good challenge. I think there is so much out there, and it is very difficult to know, you know, and every day there's something more that comes, you know, that comes on, so it is a challenge.
The Dorset Youth Association, I think they might have paid Google to get them up to the top of their Google search box. So, and I will make sure that we send the link, because the website behaves like an app on the phone, and you can go to any area across BCP or Dorset and hover over it, and it's not just about mental health. There's all sorts of information. It's a really well designed and designed by young people actually. So we can make sure that happens.
Thank you. I'm just aware of time, but I've just got a couple of things that I just wanted. Firstly, the drop-in cafe. So obviously the ICB are doing their place modelling, aren't they? And we've got family hubs and stuff for you. And I think we're going to be talking or hearing more about that perhaps March time. So I just wondered if that was something that maybe Kathy wouldn't mind piggyback services or something, have that discussion there. I was really delighted to see that diagnosis label being taken away, particularly, you know, ASD or the fear and the rumours that you hear of ASD children and young people being excluded from CAMS and having to find different pathways. So that in particular is extremely welcome. On slide 11, you talked about the governance side and the management of progress. And I just wondered what outcomes you were measuring and how or what success looks like.
In terms of this project, actually getting to the end of it and having something that looks like it can be really delivered on the ground, because you've all been looking around. Some of you have been around quite a long time, and me included, I have to say. And I've been in so many meetings where we've just had constant conversations, saying the same thing but never really getting there. And this project, I think we've done a really good job, and I'm not blowing my own trumpet on that, but I think we've done a really good job at bringing partners together. We have a conceptual model, and we're already starting about how that can work in reality. And so I'm not prone to hopefulness, don't get me wrong, but I am feeling quite hopeful because we've actually managed to stick in a room together, keep talking and have some really challenging conversations. And we're not going to find that any easier going forward, because I suspect we're going to find lots of different challenges as we move into the workforce conversations and integration conversations. But we're quite dogged, aren't we?
We are.
Yeah, stubborn, annoying, like dripping taps. I don't know, but, you know, that kind of thing. But so hopefully we'll get there.
Thank you very much. I'm afraid on this item, that's all we've really got time for, but I know that we could probably sit here and pick your brains for a lot longer. So our sincere thanks once again for everything you've put here. It says it's recommended that a committee consider the presentation, the update and any or target any further future scrutiny if identified. We've got a forward work plan and we can discuss it there. Obviously, we know that the March forward plan may well include that youth provision, the early help system work. But of course, if anything comes through, then the email is always open to suggestions. So please feel free to include anything. And of course, we don't need for it to come back to here. If there's anything that comes out, we can email yourselves and get those answers to ensure that we can provide that out support out in the community. Thank you very much. So the next item we have is a send improvement update. I don't mean to embarrass you. Are you okay where you are? Do you need to sit near a plug socket? Okay. Okay. So we've got Sharon Muldoon who is joining us. Oh, hello, Sharon. And Rachel. So thank you. Over to yourselves.
Okay, good evening. I have a presentation to take you through. I'm sure it will have result in a lot of questions. So if I go through, as I've done, the slides, give you an overview, and then obviously more than happy to take any questions in that space. So whilst Rachel's loading that, just to introduce myself, my name is Sharon Muldoon. I have been brought in to work with Kathy and colleagues to make improvements in our SEND system, and I think we all know that improvements are needed. The presentation that I'm going to take you through today is a result of a diagnostic that I conducted, and I'll talk you through that once the slides are up. In terms of my role, I've been brought in as an education improvement consultant to work alongside Kathy and the team, the SEND team in the education space, but obviously including those key departments across the local authority and indeed with health. So that would include, as we mentioned earlier, how we work well with adult social care in that transition space. It's also absolutely aligned and linked to the previous conversation around our mental health support for children as well. So when we've got the presentation up, I will take you through that. Brilliant, thanks Rachel. Okay, so the first slide just provides an overview in terms of the approach, the diagnostic, just so that you are aware of how I got to the findings that are detailed in the plan. So as I said, I joined in September and over September and October worked across the service to understand our current performance and outturn position for SEND. That involved a diagnostic, so starting off looking at the local authorities, but also the wider SEND partnership, health, schools, etc., strategies in place relating to our statutory duties for SEND. I also looked at a conversation with our existing service managers and heads of service to really start to ask them to produce operational documents that I would expect them to have in place that would allow us to understand the health of the system. So they might be minutes of meetings, they could be examples of recent education, health and care plans, but generally getting a view around the kind of throughput of activity in the system. Really importantly, as you would expect, listening to the views of our parent and carer organisations and understanding how they feel about our current system, some of the issues and challenges that we face, and making sure that we're locating the views and lived experiences of our children and young people in the system. So that was pretty much kind of a desk-based review looking at key documents. I then moved into structured interviews with the heads of service and service managers. And it was in the SEND team, but importantly also featured into other areas too. So, for example, into the children's team in social care that look after our children and young people with disabilities, but also into our attendance service, which will be supporting our children who are either SEND support or HCPs with a plan in place. Kind of getting a feel of what's going on, what's our performance, what's our outturn, where are the issues. And then I looked to the education structure to understand how we're configured in how we deliver our local authority services, what options are there for further improvement, where is it working well, but equally, where might there be some blockages and barriers in the system. Outside of the SEND officers and education officers and social care officers, also I took a look at the business support processes that are in place to support our children's pathways and the outcomes and development of their plans. And so I've just listed the kind of areas that I looked at there. And then finally, looking at sort of a partnership level, the SEND Improvement Board that has existed for some time to really understand how well is that working, what improvements do we need to make there, and what are the views of colleagues in that space. So moving on, and I'm not suggesting that this will be a significant surprise given your recent history. I've made a number of statements here, and I think we know from the level of complaints that we see from our performance data that we have a number of improvement areas, and you've had them for some time. So looking at evidence, looking at our data and listening to the lived experience of our officers, of our schools, etc., we know that we have at this point in time too many children who are not accessing their full entitlement to education, and particularly a lens on those with SEND support and with an EHCP, where there may be issues and barriers in the system. Not only that, there are too many children that are experiencing significant delays in the system, and there is some good news, and we have, alongside this diagnostic, been looking at improvement initiatives, and I can come back and talk about those at another point. I mentioned that it was important to look at the quality of our education, health and care plans. How well do they represent the views of the children and young people? How ambitious are we for our children with SEND, and what impact are we having? And working alongside colleagues within the SEND service, within Rachel's team, and indeed with colleagues, peer colleagues from local authorities, we know that the quality of our plans are not yet consistently at a good standard. What I do need to say there, that isn't uniquely a local authority officer issue, that's about how the whole of the partnership work together to develop those plans. So that will include the role of health colleagues, schools, FE colleges, etc. So it's a system review of the plans, not just the local authority aspect to that. We know that
we want more children in our mainstream settings. So often there can be, listening to the views of Parent Care Forum representatives, sometimes there are barriers or perceived barriers about children and their position in mainstream education, and really thinking about what more do we need to do with schools to provide an inclusive education where that is appropriate and is right for the child. So we heard about some issues in terms of perceptions around inclusivity in the system. Thinking about our relationship with schools and thinking about our progress in this area since LGR, we need to think about how the whole system works for BCP, and also think about our relationships and how we foster a culture of working together. I think sometimes some colleagues that have children in the system, it can be quite adversarial. You can feel you're caught between a number of organisations. So really how we work together with our schools and ensure that we have a common purpose around that and a clear expectation of the system. We have the written statement of action, which came on the back of your Ofsted inspection. And my view of that, my independent assessment of that, is that progress has been too slow across the work streams. That's not to undermine the effort that's gone into that, but I think that there are indeed quick wins that we can make to improve that. And I'll come on to some positives around that. But we need to do more and at pace. And then finally, listening to the views of our officers, but also I looked at the child's pathway, I could see that our services are sometimes quite siloed. It was referenced earlier about children and families having to tell their story more than once. That will be the experience at this point in time, and there are absolutely things we can do to improve that and make that better. So from a children's point of view, more to do. The next slide, though, I did want to focus on the positive because there are positives in the system, and I believe that these positives will be enablers through Kathy's leadership and the management effort that is going into these services to make improvements. So our ability as a local authority to improve services is absolutely wholly dependent on our staff's ability to believe in the ability to make progress and to feel supported, to feel well led, and to be able to make a difference. The really positive news, and I'm very proud of the team that I've been working with, every member of staff exclusively have been very open with me about the issues in the system. What I haven't sensed is a feeling of being defeated. Elsewhere where I've worked, sometimes that can be a sense that it's so overwhelming. People lose their ability to see for clear what needs to happen. I have been genuinely very impressed by the staff that I've met, and they have been very open and honest about their experience and their frustrations. But moreover, they're able to talk about the solutions. So when I was speaking to them about, okay, get you frustrated, what more could we do? They are absolutely in the headspace of these are the things that we think need to happen. And I have been working with them closely on that, and we are making improvements. Staff aren't defensive, they're open for the need for change. I think they have experienced some frustrations around pilots and systems that haven't quite worked, but there is still that energy, a real positive energy in the service for making change. And again, I can give some examples of that later if you so wish. Staff are saying that there are green shoots happening. So through the direction of Kathy and others in the team, before my arrival, we could see the foundations of solid actions which will make a difference, and moreover, they will be sustainable. And that's creating a positive energy and momentum in the service. We know that SEND should be and is everybody's business, and so it's important that we reach to other agents or departments in the system. And again, my exploration so far is other departments are keen to work with us and have a positive energy, making a difference. So whilst there is much that we need to do, and there absolutely is, I do believe we have a workforce and a commitment from officers and leaders to make the changes we need to see. That being said, there are a number of broader governance and strategic documents that do need to be in place in order to have an effective SEND system. I referenced earlier that I looked at a number of the strategies. The slide in front of you identifies the strategies that should be in place for the whole of the SEND system, and these are often joint strategies with health, with schools, with the voluntary community sector, so not uniquely always local authority strategies. However, listed in the presentation are a number of strategies that we need to improve upon and get right. So my diagnostic was many of the strategies need to be refreshed. They need to link to the changes we have seen in the green papers, etc., and actually point towards the future. So they're listed there for your acceptance. The other area for us is that overarching education strategy. So being really clear with the changes that have happened in the sector. What is the role of the local authority? What's in our control? Our statutory duties are, and how we work with schools. So the good news is that officers are now working on those strategies, and a number of them are with me now as draft form, and we will be developing those and get those over the line in the next month or so. Moving on, education and the overview really in terms of governance, and communication is key in this, and we are talking about a multidisciplinary service and system. I found the communication processes to be a little fragmented or too fragmented, so we need to do more to have better communication with our schools, but equally with our parents and carers, and that starts, for example, with a very clear charter, which we commit to parents to do a number of things. We have a massive opportunity to, through the transformation work that Kathy's leading, in terms of how we integrate our early help offer and our locality programme of work. And I think the time's right to make some quick wins in that space. In terms of performance data, understanding our relative position, there is more that we need to do to finesse that and make sure that we can see real-time data for children in the system now, but also processes for children who are have experienced significant delays. And again, I'm happy to talk about that. Overall, there was more that we needed to do to use our data and intelligence to make informed decisions. That work is well underway now. So in terms of next steps, we need to develop our strategies. We are doing that. We've agreed that that's necessary and they're underway. And it's also important that our business as usual service plans absolutely focus on key business processes, and we do not lose sight of delays in the system. So they are under development. Have a clear line of sight in terms of what we're most worried about, and making sure that we have a transparent risk register so that yourselves can be appraised of the issues in the system, but equally we hold each other to account in that systems leadership space with schools, with health, etc. There is a requirement for us to have a clear quality assurance process in place. That's true for the local authority. It's also true for how the partnership responds to plans. So the role of health, for example, the contribution of schools, etc. And we need a clear communications plan. We are meeting, we'll be using our forums with head teachers to improve on that and give some clear measurable outputs. I think there's been a lot of volume of communication, but not always necessarily a clear plan as to how we move and develop the system forward. The next couple of slides, I won't take too long because I'm sure you probably want to get into the questions, but what I wanted to do is give you transparency in terms of the key themes that I believe we can focus on and we can make improvements in our system. And this presentation, I should say, has gone to the SEND Improvement Board on the 27th of October and has been accepted as an appropriate way forward, and we're now working on a new improvement plan to that sense. So I won't go through line by line here, but in effect, what I'm giving you in the presentation is a list of things that if we get right, or not if, when we get these right, our children and young people will be better supported in the system. One of the key enablers for us is around our workforce. When I've looked at root cause issues, particularly around the local authority processes, it has been around, and we talked about the impact of COVID earlier, it has definitely been that in the middle of an improvement journey. But it's also about having the right structure in the department, the right succession planning. So when we lose case officers, we're not then in a recovery place. So a big part of the work is how we work with our workforce to create career opportunities and stability. And there's some very good plans in way. And again, data is important. Final slide. Our education psychology service, we have seen, as you will be aware, a significant increase in requests for assessments, and we do need to make sure that we're able to meet that throughput and demand, and so that will be an area. Okay, so nearly there. Moving to the next slide. Building blocks for the future. So my appraisal was that we've had lots of actions linked to an Ofsted report of 2 years or so ago. And actually what we need to do is configure ourselves around the parts of the system. So the list in front of you there starts with early help and identification in that universal space, all the way through to managing the resources that we would expend in this area. I took this list to the Centre Improvement Board. It has been agreed as the key areas of the system. It is the areas that Ofsted would look at in terms of actually how well are we performing. So now work is underway to develop our plan. For example, tomorrow we have all the heads of service in a meeting to populate our plan. It's sort of 40% of the way there now, but with clear, tangible actions over the next 3, 6, 9, 12 to 18 months that will actually provide you with the evidence and impact of the improvement activity. So just one final slide, I think, looking to the future. So a clear strategic plan. It has been agreed that's what we need to do, and we will be writing that and issuing that and sharing that for views in January. Improve our governance, so we're absolutely always on the ball, using our data, seeing what's happening for our children and making sure the right people know the right message in terms of improvement activities. Sorry for the acronym. SEF is a self-evaluation framework. So that's a physical document we have to produce that says this is where we are. These are the things that are good and we can celebrate for our children. These are our improvement areas. That's a document that we have to share with Ofsted as a leadership team involving health, etc., the whole system. And it basically says this is where we think we are and it's how well we know ourselves. And then a real focus on operational imperatives. The good news is that work has already started and we are seeing green shoots in our progress. So for instance, all of our children, live system 6-week decision making are now being made within 6 weeks at the first request for an EHCP. And that's a significant improvement and will continue to improve further on other parts of the system. So there's a lot in there. I've tried to give you an overview of the work, but if I open it now to any questions.
Yeah, thank you very much. I'm a substitute on this committee, so I only recently substituted this afternoon, so I've not been through all the papers. At a previous, I'm sure it's a previous committee that I sat on. I understand the council's approved additional funding for additional EPs to cover the backlog of EHCPs. Just like to know if that has actually started and manifested in, have we actually got. Are we seeing any sort of results from that? Have we had time? Or is it too early to tell? Thank you.
So in terms of have we started that programme of work? Yes, we have. And we are beginning to make progress, but there's quite a big backlog, as you're probably aware from the previous reports. It will take some time to move that through. The other issue, the blockage isn't always uniquely in that space and it might be elsewhere in the system. So it's working concurrently with that. In terms of the additional resource, I don't know what's been before you before, but educational psychologists are quite difficult to recruit and the capacity and market issues are real. So that whilst the money has been there, we need to make sure we have the right quality of ed psychs and that we are comfortable with them and can introduce them in an appropriate way. So in terms of relative impact, I think it will be January before we'll start to see a significant impact based on our recruitment process. The broader point for us is how do we make sure that outside of that injection of money, when that money goes away, that we've got a system that will work well and we don't create a problem for the future. So working with our head of service and EPS, we're looking at that now, which really takes a view to making sure that once we get out of this situation, we've got the right level of resource. And that we've got an acute focus on our core processes.
Did you find anything in the form BCP system that incentivised schools to push for or providers to push for EHCPs, or does the system effectively incentivise early help support, or is there not an issue there?
I think the answer to that is there's more that we need to do, and I think there are some schools that will work very well in that early help space, others that we need to work with around actually how to do that well, how to be confident in doing that. We do know in terms of our data that we have a disproportionately high number of parents directly asking for an EHCP without working with the school and going directly to us as a local authority rather than through the school. So that would point, and we're just doing the analysis of that right now, that would point to potentially some nervousness or some issues about why aren't our parents working with their school and going directly to us first. So I think I would describe that as an immature system. We absolutely do have, I was speaking to one head teacher this week, some excellent practice in our schools around inclusion. Equally, we can see there are some settings that we need to help support them in getting confidence in that early help space. And that is around our work with Senkos and how we support our leadership and workforce dialogue in that space.
Councillor Harman.
Thank you, Chair. I wonder if you might have just answered my question then, but thinking back to your first slide where you identified many of the issues that you currently see, I'm just curious to know which one of those things concerns you most, or where are your biggest worries in what we're facing?
If we focus on children, which is obviously why we're here, it's the length of wait that our children have experienced, because we know some of our children have been waiting in the system for a long time, and thinking about what that means for them, for their family, and for their perception of education and their engagement with education. So what would concern me most is how we absolutely get to the point that our statutory processes mean that decisions are made and we are doing that in a timely fashion without the frustration and delays. So the backlog is my concern, but equally, I do think that there are things that we're doing now that would prevent us from getting into that space ever again. And some of that's around our use of data and intelligence and predictive work. Moreover, though, it isn't just the local authority. So, for example, as we start to improve our processes, we can see through our improved data who are the schools that haven't returned their part of the assessment process in good enough time for us then to do our next step. So part of our diagnostic hasn't just been about looking at the local authority processes, which did need to improve. It's also about actually how do we work better with schools and engage with them, and there's some issues there around communication, correspondence. So the backlog would be my concern, but then creating the confidence in the system to say that isn't accepted and we move forward from there.
Thank you. I'm well aware of time, so I'm going to give the last question to Dylan. I know there were some other questions that did want to be asked. If that's the case, could you please email us? What we'll do is I'll ask Sharon and all the team to answer them, and then we'll add them to the minutes just to make sure that we obviously have got that deep dive that we'd really like. Dylan, thank you.
Actually, it's a really quick one. I mean, I could also be asking Sarah Rempel about this as well, but with the Head Teachers Forum, has it started to come to fruition, or is it still really hard to get United Learning and that kind of thing into the mix?
I think the answer is work in development. Our next forum is the 5th of December. We've actually just agreed the agenda today. The substantive item is this piece of work and our engagement with schools. So more to do in that space, but an absolute focus of using that forum as the way to have those conversations. We will be looking at attendance, so we'll know who does and doesn't.
Thank you. So it's recommended that the committee consider the update, target any future scrutiny if identified, and of course any questions that we can send in via email and add to the minutes. So just we can consider the future scrutiny under the forward work plan. So thank you very much. Right. So we've had some items that we've circulated outside the committee. They were quite heavy papers, and but I make no apology for that, because I think it's really important that we all understand and have the same understanding of where we are, the journey so far, and where we're headed. So the first one was the Independent Review Officer's annual report. We did ask for email, for questions to come in via email, and I haven't had any. One thing that did come to mind was that I know previously when we've had annual reports, there's been some query around the confidence that the IROs have to challenge, and it's quite clear at the start that that has been a hurdle, and there's that confidence and that faith in knowing that the IROs will be challenging where appropriate. And the second item will be the corporate performance. update, and of course that will be a standing agenda item which we'll have by email every committee meeting. And again, I've had no questions on that received by way of email, but I can, if it's okay with yourselves, another week or so, if something comes through, then just email them through, and again we can add them to the minutes as well. So we've now got portfolio holders update. Don't know how quickly you could talk, Councillor Burton.
I've made a note here. I'm going to keep it short because your agenda is so full. I just want to mention Ofsted Monitoring Visit 5, which we talked about at the last meeting. It's about to happen. The specific focus on children in care, KIC services, children's social care. I'm being interviewed next Thursday by the lead inspector, and it was, I'll say this Thursday by the lead inspector, and it will be happening next week. I mention that because I know you'll be interested in the outcome of that, and also bear in mind that our officers are going to have their mind on that very much this week and next week. So therefore, if they don't get straight back to you, that might be the reason. They're looking very calm here at the moment, but I can assure you that they're not. The youth parliament debate has already mentioned, so I won't talk about that, although I've got a few interesting comments, but yes. We've also had the reminder of the training session on the calendar of the 29th of November. It is already in your calendars. I will be emailing everybody like I did last time. Don't take it personally. I just like to champion these things because it's nice to see. We had a great turnout at the last one. Lastly, just I attended a rather interesting Keeping Young People Safe conference on the 14th of November, where we had some very informative and knowledgeable speakers. I find it quite an emotional one, actually, because of some of the things that were discussed. The person who opened it was actually our PPC, our Police and Crime Commissioner, and it was the first time I was able to have a proper chat since his input into the Child Exploitation Working Group. And I was able to thank him on behalf of the committee because he did a really good input at that point. I mentioned that because I noticed it's still on the forward plan, so I just thought I'd sort of flag that. Short enough.
That was amazing, and I know that you have been working hard, and there is more that you can say, but I do thank you for your brevity. So next on our agenda is the forward work plan. So I've done some work with officers, and they are really full agendas, but I think that does reflect the amount of work that's going on at the moment, and there is a lot of work coming through which does need oversight and our attention. So we've had a bit of a rejig with the January meeting, which we hope will give us more time to discuss some items in depth, but then also take it offline, receive paper copies or virtual copies of the reports, and then also email questions in. If it comes to it that we find there's some real concerns around particular papers, then of course we can bring it to committee. But we do think that perhaps finding a balance between having some work done outside of the meeting could be more productive, or else we are going to be here all night, I'm afraid. So we have decided, and Rachel, this is literally hot off the press, so just bear with me, and Rachel's going to correct me if I'm wrong. So we will have had, obviously, the safety valve submission by then, which was the 12th of January. So we were just going to ask by way of email a confidential report so we can see the actual submission, if that's okay. The school's admissions to have that by information email purposes. Childcare sufficiency review, again by way of email. But what I would say is if there's anything around that area that you think really needs to be raised, then please do so. And the corporate performance, of course. That then gives us time and space to hear us. We're calling them our major feature of the SALT report, the speech and language therapies being introduced by Christine Rainsford, who's the Commissioner for Dorset Healthcare Trust. Yeah. And then we've got Kelly Twitchen from the virtual school, who will be speaking to us not only about the validated results, which are the results that our children in care will have received having gone through the virtual school, the education system, how that compares sort of nationally and with, sort of like councils, but also with that, the exclusions and fixed term sort of suspensions and exclusions that we've historically, nationally, always had a real challenge around, and we really sympathise with the environment, sort of education environment, because the two, when you're in trauma and in education, don't always gel. Like, you know, there's been some work going on with that, so we're bringing those two together. And then with SEND improvement, there will be a new improvement plan being presented to us, which we felt was really important to ensure that we've got oversight of that. So those are the three items that we'll be receiving in person at committee. Have I forgotten anything?
Sorry. We just said that we would theme the meetings now, didn't we? Children's social care for one, and then education for another, so that we didn't mix up the topics at each meeting.
So that's an ambition we would really like to achieve, but we are aware that there's going to be some give in the system because of the work that's coming through, which, you know, it is what it is, and we just have to ensure that we're flexible in our approach, but we will, of course, try to theme it. And then, so is any comments on the January forward work plan at this moment in time? We can email it out, and again, probably by the end of the week, if it's okay, if you could get that back to us, because we need to publish it, and officers are obviously going to be starting to prepare their papers. So before I move on, anything from anyone? So with the March, which looks remarkably quiet, I'm afraid it isn't. So that will be social care themed, and children's social care improvement journey, the update, will be coming to us. It's been quite a journey. I'm not sure if you'd have had the monitoring number 6 by that point, but it'll be there or thereabouts. So, and then as I mentioned before, the early help system is a preventative work, and that will include youth provision, youth offerings, family hubs, the community and voluntary sector offering, and how all these partnerships and stakeholders work together, and what it means in terms of outputs at our young people and those who really need that first sort of identified help, ensure that they get that help. And then we will also have some work on the transformation agenda that's coming forward. So I believe that there will be a consultation going out in springtime, and obviously that will be coming here so that we can talk about it, understand it, and see what it actually means for our families, and for our staff. So that's a building stronger foundations business transformation presentation. I'm going to take a breath. Anything from anyone at this moment? Sorry, Dylan.
I'm right in thinking as well, that'll be when me and Zara finish our term, that March one. So there'll be a youth parliament handover, and you'll meet the new one as well.
Yeah, absolutely. You haven't been forgotten, I promise you. And we will make sure that you absolutely get the time on the agenda, because we do really value all the work that's been done, and as tonight's shown, you know, clearly really helping to shape some of the services that other young children are experiencing. We've got foster carers on the forward work plan, but we feel that this is probably a corporate parenting agenda item, and probably better heard there. And then the harmonisation of children's services is also still outstanding on there. And again, I think most of that work has been completed, but where there are some hiccups, that transformation work will pick up that, and you'll be devising a new system for children's services as it is. And then that brings us to July, and at the moment we've got respite and short breaks as a suggestion on there. Kathy looks horrified, but and I must say, and I've said it before, there is a lot of work coming through, and I know it doesn't just get cobbled together. You know, officers are putting a lot of time into doing this and ensuring that we can scrutinise and have a look at these items. So my thanks once again to your team, but in particular Rachel, who's been absolutely amazing in supporting us, and the panel. I know she looks like Penelope Pitstop tonight, doesn't she? But is there anything from anyone at this moment, or we can get that typed up, sent out, and then just sort of returned back to us by the end of the week, if that's okay with everyone? Cool. Haven't heard any dissent. So next on this item future meeting dates, so the 23rd of January and the 19th of March. And I think there's a July one penciled in at the moment. We next come to the exclusion of press and public. And Tadley, I just wondered if you could explain why we're going below the line on this one, please, and then we'll take a vote on it.
Okay. The conversation we will have when I present the paper will enable you to understand why it is below the line. But I think it's about there is more work to do in this arena, and also where there may be impact on staffing, which obviously hasn't been finalised at this point, and so it would not be appropriate for this to be a public paper.
So with that, is everybody happy to switch off the recording and hear this in an exempt item at the moment? Yeah, thank you.